Hello and welcome to allpointstv.com. This is Sam Jahari from Briona's Legacy. And today I want to share with you, more of how we got here. I hope you like the background and stuff. This is who we are, Briona's Legacy, and our presentation is Slaying the Dragon. We're done chasing. It's time to knock its head off, all right, with this addiction and stuff. So, well, how did we get here? I told you about, my daughter, I went through the rubber and she was conceived, and, that was like one of the happiest days of my life, the day she was born and stuff. Well, 3 years later, I had to go into the court and fight for custody of my daughter because her mom was an addict, and I needed to get her away from her, and that's how I found my mate, my soulmate in life, and so I was able to go into the court and petition the court for custody. And at the time, I really wasn't looking at custody or whatever. I mean, I was looking at taking care of my daughter, but when I found out her mom was on the street and stuff, and she was really in bad shape, I knew I had to get her out of that home. So, I went into the court system, and I remember it was a lady judge, and this judge, what happened is, at the time, the mom had went into the court and told the judge that I was going to take Briona overseas, and I had to turn in my passport, and that's how she came and picked her up from my house. So anyway, when I went into the court, what I don't understand is a lot of times these judges, it's like they already got their mind made up of who you are, and you haven't even said two words yet. That's just how I felt anyway. I felt this judge was really for the woman, and she she didn't really care who I was. But as we started telling our side of the story, how we needed to get her, get the baby away from her, that she was an addict, and it was still, the judge pretty much, she said that she was going to be staying with her mom, and her mom was ordered to go to rehab. And at the time I stood up and I was like, Your Honor, how can you trust the baby with her mom? Look at her arms, she's got track marks and stuff. And the judge looked at me and she said, one more word out of you and I'm going to send you to jail. I was dumbfounded. I guess I kind of I'm a hothead, I guess. Maybe I came off sarcastic or something to this judge, but it's like you look at these authority figures and you think, well, they ought to know better, But it was because what Tina had told her, that I was going to take her overseas and stuff. So that's how she's seen me, I guess. So anyways, I think we were supposed to come back a couple weeks later, and which a week into it or something, where Tina was staying, this girl called me up and she says, man, you got to get your daughter out of here. And she helped me to get back into the court, and she pretty much spoke about that our baby wasn't in a good position. So at that time, when we went into court, the judge asked if Tina had gone to rehab, and she said no. And she told her, okay, he has full custody and you get supervised visits. And at the time, I don't know, she was trying to say something, no, this ain't right or whatever. She told her, when you get clean, then you take them back into court. Well, through life, Briona, I think she had a pretty good upbringing. I mean, she had a nice home for her, and I ended up with having two more boys. So she had a family, and she's a very lovable kid. But I know she struggled, with her mom being in rehabs or in prison or whatever, and I tried to, keep her mom in her life. I don't know if that was the right thing or a bad thing or what. I just felt like I had to do what was right for my daughter, and she wanted to see her mom and stuff. It's like you have children; they don't come with directions, and it's all these new things that arise, and you just make the best decisions that you think are right, and that's what I tried to do. Even though, after you look back and did I do the right thing? You double guess the decisions that you make, which I do all the time. But I loved her more than anything, and through it all, I mean, I was always fighting for her. When she was in, I think, fourth or fifth grade, her teacher says, she has C's. We should probably not graduate her. Let her come back to the fifth grade because she started early, and I think she's got ADD. I'm like, why would you want to hold her back just because she's got C's? So what? The kid is very intelligent. You as a teacher, you're probably not bringing out her best. Obviously, you think that there's a problem with her. Well, I never went that route. And Briona, she didn't care to be like number one in the class or number one on her soccer team. She, even though she was very intelligent, she was a very good athlete, she was witty, she was smart, she had a beautiful smile, she had a good sense of humor, She didn't care to be like up in front, she'd say, I coached her in soccer. And that was weird because, I wasn't really a coach. I was an athlete, but I wasn't a coach. But this one time we were at her soccer game, and she had a really nice coach, but it was just a mom, and she didn't know anything about coaching, obviously, but, she volunteered for this. So this one time, everything that happened on the field, good job, but there was no criticism of what they were doing wrong, or, they weren't told of anything that went wrong out there. Everything was a good job. So this one time they had gotten scored on, and, the coach is just clapping her hand, good job. And I'm like, how's that a good job? I'm talking to my wife, and my wife says to me, she says, don't open your mouth. This lady volunteers, and don't open your mouth unless you're willing to volunteer. And it was like, well, I can do this, And from there on, I started coaching not only my daughter's team, but both my boys' soccer team, at the following year. And I loved it. I loved that that one-on-one. And like I said, Briona, she could have been the best, on the team, but she settled for being third best, or fourth best, and she was okay with that. And I tell her, I said, Briona, if you would just put a little more, she'd say, I'm just fine. I'm okay with that, She didn't want all that attention. But anyways, as Briona got into junior high and stuff, sure, she had these I guess these signs of things that she was going through, with her mom and stuff. Briona and her mom, they would she would be mad at her for 6-8 months, and then they would make up because her mom would go back to drugs or whatever. And as she got into the junior high, this happened again. Now, in the 8th grade, Briona, before, I'd say a couple weeks before school let out, or about a month before school let out, her and her mom had made up. And when they made up, her mom had relapsed, and she was worried about her. I remember this because this one day it was like 11 o'clock in the evening, and it was probably a week or so before Briona's graduation out of 8th grade. And I came into her room, it's like 11 something. I'm like, honey, why are you still up? You got school tomorrow. And she said, oh, I was just waiting for my mom to call me. She said she'd call me when she got home. And later I found out that that she had relapsed, and she was worried about her. So well, as Briona graduated, they had a special thing for graduation from 8th grade. They're getting ready to go into the high school. And Briona's mom came to that, and Briona was so excited. She looked so good. I went and bought her this dress that she was so happy, and her mom was there. So anyway, about a week later, I remember it was like a Sunday night, and I had just picked up Briona. She spent the night over at her aunt's house, and we were coming home. And Tina says, Tina was on the phone. She was talking to Briona, and Briona's like, Dad, my mom wants me. She wants to pick me up and take me to this carnival. And I said, she had just relapsed, and overdosed, almost died, a couple weeks back. So I'm kind of worried about that situation. So I said, no, that's not going to happen. So, Briona, why, Dad, this, that, and I said, no. She said, well, my mom wants to talk to you. I said, no, I'm not talking to her. Just tell her the answer is no, and that's it. Well, it was the following day that we got that dreadful call. That her mom had passed from an overdose. And I remember Briona was, she had came out of the shower, and she was getting dressed and stuff. And I told her of, that her mom had passed. And that was so hard for me to do. And of course she broke down, and I think she just cried so much. But in the long run, is like she knew that she was at peace, and she didn't have to worry about her anymore. And Briona, she we went and did the arrangements for her funeral and stuff like that with her family. And at the funeral, Briona gave the eulogy, and I was so proud of her. She was 12 years old, and she just she stood tall, and she looked at all her mom's friends and stuff. She said, I know this is going to be just another reason for you guys to go out and use. But this is what drugs do. They kill. This is what drugs do. And don't let this be another reason for you to go out and use tonight. I was so proud of her, I in my whole life, I never thought that Brianna would turn to drugs or even try it. But, Brianna's whole life, she'd always say, Dad, why does my mom love the drugs more than me? And, I really couldn't understand it. I didn't, I was no saint. I mean, I tried marijuana. I even smoked crack a couple times, okay? But I don't know. I never got wrapped up in that. And, snorted some lines. But that just, I didn't let nothing control me. I tried to control every situation that I was in. But I don't have that addiction gene, obviously. And I didn't give it a chance to take over my life. So I thought, well, this is choice. This is what I was thinking of addiction, okay? That, this was in her hands, and she chose not to quit. Well, after that, I think in ninth grade, I could tell my daughter had changed. There was something that died in her too, after her mom. And I just thought, time she would heal, I tried to get her to grieving counseling and, her therapist, because she was in therapy, to go more into the grieving and stuff like that. But for some reason, Brianna always, I'm okay, and I got this, and don't worry about me. Well, in ninth grade, they had somebody at the school, and I think it was Department of Human Services or something, and they were talking about being raped or sexually abused. And Brianna at that time came forward, and she told, the people there that she was sexually abused by one of her mom's boyfriends. When she was 9 years old. And it was like, as I tried to follow up on that, Brianna would never talk to me in detail. And she'd just say, I'm not talking to you about it, Dad. So, I talked to the counselor at school, and it's like, well, what happened with this report and stuff? What did they do about it and stuff like that? And I just, which I found out later because I got these reports after Brianna had passed, that they didn't pursue this because Brianna only had a first name. She didn't have a last name. So they really didn't do anything. Here's another thing of being into the system and having the system just kind of slap you around, and didn't really do anything, for her or for us as a family. Okay. Later, Brianna was having all these problems, obviously, and at the end of that summer of after she got out of ninth grade, Brianna started trying alcohol, and I think she was cutting herself, and at that point I took her to Hurley, and they sent her to this I don't know, rehab, or I don't know what it was, but she was there for 9 days, to deal with her issues that she had going on, which as a parent, I don't know what's going on in her head, and she's not really talking to me and stuff. And anyways, she came out of the hospital. She was she wanted to go away. She was just very unhappy being at home and stuff. And that was when I sent her away to her uncle in Tennessee. This was Tina's brother, and I thought, maybe she can get closure of some sort that way. So she went to Tennessee, and Briona came back in the middle of that. January. It was January 2009. Well, she wanted to go to a different school, which we set that up, and everything seemed to be going good. Then February come along. February 2009, February 11th. One of my sisters ends up coming up missing. And us as a family, I have seven sisters and me. There's 15, 16, grandchildren or nephews and nieces. I have 3, and then another 13 nieces and nephews. And overall, we're a very close family. Every Sunday, we're either at mom, dad's, or we're at one of the siblings, or at my house, and the family, got together. And well, after my sister come up missing, well, even before she came up missing, my sister, she struggled with bipolar. And this we were noticing that she was kind of depressed, and she had a daughter. And before we got to this, my sister turned her into the state. We decided to do this as a family. It wasn't just my sister. I have one sister that made the phone call, but my sister, she hardly ever slept. She had a baby. There was no food in her house, no matter how much, my mom looked over her, and my dad, and us as a family. She was just, she was in her own world. And this happened probably about a year before this, of February 2009. Well, anyways, going through the system again, with the community mental health and stuff. And we would call her caseworker or whatever. She's smoking in bed. She's gonna burn the house down. This, that. And they would come for her visits, and they would say, well, she wouldn't let me in. So I couldn't see what was going on in her home. My mom, she had guardianship of her, and they didn't let her know anything. So all of a sudden, here's another part of the system that dropped the ball that we felt, So February 11, 2009, this sister comes up missing. Last we spoke to her was like 11 o'clock or 11:30 at night. My one sister was talking to her. And the next day, my mom had, she had her daughter. She was living with her, with my mom. So she would have her daughter call her every morning, to tell her good morning and that she was going to school and stuff. Well, that morning she didn't answer the phone. So when my mom went over to the house, it was like, the house hasn't changed since the night before, where my mom had came, and Rhonda was going to take a shower or something, and my mom put all her clothes out. And what was weird is Rhonda was like a heavy smoker. She would call every one of the siblings, and she needed her Pepsi and her cigarettes. That's all she cared about, you know. Hey, I don't have any Pepsi, or I'm running out of cigarettes. So, we all took turns, or we'd bring her cigarettes and made sure she had pop and stuff. So when my mom got there, her cigarettes are there, her driver's license is there. Her bed doesn't look like it's been slept in, but there's no sign of her, and she just disappeared. So, we just, in the beginning, we just thought maybe she just walked off. Well, let me tell you who Rhonda was. Rhonda, she was an actress. She was a model. She was a writer. She was an artist. She was beautiful. So all of a sudden, this person is bipolar, and you could see her regress into her someone that's different. And before she come up missing, it's like this person had changed so much, I think like she didn't have a will to live, or she just didn't like her situation that she's in anymore. Well, anyways, after she comes up missing, she with the police at first, they didn't believe that, she's an adult, she probably just walked off. Then okay, we don't believe she just walked off. But it seemed like they dropped the ball too, I don't know, how does someone just disappear in this day in society, with all the technology and everything that's going on, and somebody just disappears without a trace? Well, Rhonda did. And about a year into it, this whole family, of how close we were, it was like a bomb had went off within our family. And everybody just kind of was trying to do their own thing, this one's playing detective, and this one is, making sure that, we keep her face out there, and people are looking for her, and this, and instead of uniting us and making us strong, is like, like I said, it's just like a bomb went off, and this close knit family was at each other's throats. And I've never really talked about this, and I really appreciate this opportunity, because to me, this is kind of helping me heal too, because I struggle with depression, and I don't believe in medicine, obviously. So I try to deal with my feelings in different ways, and that's where I've been doing a lot of soul searching and finding where did it go, where did it go wrong, or what the hell happened. And it's easy to just be pissed off, at the police or the mental health community, or the therapist or whatever, but doesn't get you anywhere. So anyway, I seen my mom, she still hasn't really recovered from the loss of a child, and I obviously haven't recovered from a loss of a child either. And so as this close family, everybody's looked upon like everybody did something, and that's what it was getting down to be. Well, about 8 months into it, I felt like I needed to get a dog for my kids, because it was just this sadness, and they didn't have, their family to rely on, or to be able to talk about the feelings that they were going through. So, because, our whole support system all of a sudden isn't there. And, I had a restaurant, and so I couldn't be there too for my kids, and I guess for Briona, as much as I should have been. So what I did is I tried to get them a dog, so they have somebody, to something to make them smile. Well, this is a year later, and now Briona, she she decides, that there's this older boy that's got the same problem as her mom, and she couldn't save her mom. She thought this boy, she was going to be his savior. And through it all, she thought, I can show my mom, I can do this drug, and it wasn't going to affect me, or I can just break it. But, this boy, he, for loving him, he ended up sticking a needle in her arm. And Briona became an addict. And, when you're an addict, you just do anything and everything. You love this drug more than you love life itself. So you could care less about your parents, or you could about anybody. But she was in love with this boy. Well, she was cutting school. She's sneaking out at night. All kinds of things. She's running away. Her grades have dropped drastically. And, from that, she, I tried to get into the court system to get help. And we went through about, let's say, 6 months. And, they kept telling me, well, we're putting all these together and we're going to get you in front of a judge. And at this point, Briona had ran away from home. And, I called the sheriff department. I had the sergeant's card, that I had been talking to, and he was supposedly trying to get me in front of a judge. I told him that she had ran away from home, and I believe that she's with this boy, and I thought that they were staying in Holly. And I left all of this on the because I had called the sheriff department so many times that, okay, we'll add this to the complaint, or here's another complaint number. A lot of times I didn't even come out of the car anymore, That's what it was getting to be. So, again, this stuff is all new to me. I've never really dealt with the system, or, I guess I never really cared to. Just kept my nose clean, and that was sufficient enough for me. So, well, and I believe this is in July of 2013. July 2013. Yep. I get a call early in the morning, and it was a it was a cop from Holly. It was a lady, and she's like, Mr. Jahari, it's like 5:30 in the morning, 6, something like that. And she's like, I got your daughter here, and the reason I got her is because her boyfriend overdosed on heroin. And what the hell is this 15-year-old doing with a 18-year-old boy? And I'm like, Briona's a runaway. She said, well, I don't have it on my computer that she's a runaway. Anytime I reported her missing or running away or whatever, they would take the complaint, and they say, well, we're not going to go looking for her, but if we happen to pick her up, or we stop her, it'll be on the computer system. And here I thought that's what it was going to be. I knew they were going to go out looking for her because they told me that. But now this lady's telling me, well, she's not on my computer system, that she's a runaway. Well, anyway, later on that day, I went and got Briona. And, I took her to Hurley. And from Hurley, they, I believe they sent her to Carroll's. I don't know. They sent her to a rehab place. And she was there for 9-10 days. And the whole thing is after all of this, before we even got here, I finally get into this, to see this judge, for the first time. And this is crazy. Sorry, I keep going back and forth, but I think it's important that you hear the details of how we got here. And, I get in front of this judge, and it was like, oh, this is going to be my savior. This is going to be Briona's savior. He's going to help me, And I'm crying to this judge. I'm telling him, Your Honor, she's running away. I call the cops every other day, and, she her grades are dropped, and now she's doing heroin, And this judge looked at me, and he says, Mr. Jahari, sounds like you just want to blame everybody for your problems, instead of just taking a couple weeks off of your work and being home with your daughter. I was dumbfounded. And I'm like, how the hell did this guy get his job? How the hell did this guy become a judge? Another great time with our system. Another great moment, put it that way. And I couldn't even open my mouth. And I remember there was a lady from the runaway program that helped me to get in front of the judge. And she just said, what a fucking asshole. Excuse my French, but that's exactly what she said. She said, what a fucking asshole. She said, Mr. Jahari, don't even worry about what this guy's even spewing out of his mouth. Didn't really matter. I didn't care what was coming out of his mouth. I just wanted help for my child. And I just kept telling him, please don't let her slide through the cracks. Anyway, Briona went through two different rehabs. Within about 10 months, they finally sent her to this rehab place that she was in, I think, 5 months. Maybe 4 months, something like that. But before we got there, this one day she had, Briona had broken into my mom and dad's home. And her and her boyfriend. And they stole my mom's jewelry and my dad's jewelry and broke into their house and stuff. Well, they caught her, and he ended up getting, I don't know, 2 years or something. And finally they ended up sending her to this other rehab place. And I figured, well, as long as she's away from this guy, we should be okay, you know. But what happened is that guy was gone, but all the people that she hung out with, they were still around. So when she came out of this rehab place, you know, I guess Briona turned 17 and she decided she wasn't going to live at home anymore, and there wasn't really nothing I could do about it. And they took her off probation, and all the control was gone. At that point, she got back in with the same this girlfriend that that got her right back into it. And I remember, and she turned 17. She turned 17 October 9th, and I seen her at Christmas. And at Christmas, I gave her this dolphin necklace, because this dolphin, her mom was really into dolphins, and she just loved that necklace that I gave her. Well, she she called me on, she stayed Christmas morning and she left, and I didn't see her again. She called me on, I think on New Year's Day is my birthday, so she called me and left me a message on my answer machine wishing me a happy birthday, but she was like slurring her words and stuff, and I could tell she was out of it. Well, I think a couple weeks went by and she called me up and she said, Daddy, I overdosed. I almost died. I want to come home. She said, please, Daddy, I need to come home. I said, Briona, honey, I love you more than anything. I said, I got 2 other kids that I got to worry about. I promised Daddy I ain't going to do this shit no more. I need to come home. I said, all right, So she came home late January. And we sat down before she came home, These are the ground rules. You're going to go back to school and, get your GED. And Briona had a car. Didn't even have a driver's license, but she had a car. So you're going to go get your driver's test done or whatever. Okay. She was so excited to come home. And when she did, it was like, as a parent, you just, when your child's in trouble or when you feel their pain, it's like, you feel like you dropped the ball somewhere. You feel like you did something wrong. And I told her, I says, I'm sorry, I feel like I've let you down somehow. She said, Daddy, you've been a great father. This has all been me, Doesn't make the pain go away, but, I was glad for those talks that we had. It was like we cleared the air. And I don't know, it's Valentine's Day's weekend, But before this, I I had these parents come to my house, and they were saying that, my daughter's hanging out with their daughter, and they're doing this drugs, and the reason I didn't meet with these people, but my wife, she called me on the phone, and she says, honey, I think she's still doing it. I said, honey, I don't know what else to do. All we can do is just hopefully, we keep talking to her, and something reaches her, that something just, that we say the right thing or something. Well, Valentine's Day weekend comes along, and when my baby came home, she posted on Facebook, home sweet home, I'm glad to be home. So when come Valentine's Day, she's texting me, and she's like, Daddy, it's Valentine's Day week, and I'm going over to these friends, and I'll be back. This was a Saturday. And I said, Briona, I don't like texting. I want to hear your voice. Daddy, I don't have very good reception, but I can text you or whatever. The bullshit, the lies, and stuff like that. I said, Briona, you know what, honey? You obviously you're not gonna live by my rules. You're not gonna stay home. Oh, please, Daddy. We're texting back and forth, and she's like, I'm so happy to be home. Please, Daddy. I'll see you tomorrow. This was Saturday. Now, I have a business, so this is like my busiest day, and I'm texting her, but again, I don't have the full time that I need to give to her. So the following day, she comes home, and I said, have a seat. So she sits at the table, and I said, you know what? You told me that you were going to come, you were going to live by my rules, and this and that. Yeah, I will, Daddy, I will. You could tell she's messed up. So I said, listen, I don't want to hear anything you got to say. This is what's going to happen. You're going to go back to school, this, that. She did at this time, she did go back to got her GED and passed, and she was going through driving school to get her driver's license. So anyways, you're going to get enrolled in college, this, that, you're going to find a job, all this. Okay, Daddy, I will. So, that was Sunday night, and I said, okay, Briona, go to bed. And she got her ice or her water or whatever, and she went to bed. The next morning, I had an appointment with my bookkeeper to do my taxes. So, at this time too, my mom and dad, they were in Lebanon, and my dad took her over there, hopefully that my mom can just, to help her heal too, because my mom struggled with depression and stuff too after Rhonda was missing. And, the family, like I said, we're just we're all feuding, and couple of my sisters, they were blaming my dad for my sister being missing and stuff, that he ended up he didn't have to, but he ended up having a polygraph test just to satisfy, I guess, the detectives or whatever, because of what was being said. So now my dad, he's kind of like pissed off and hurt. So they were in Lebanon and stuff. So they spent Christmas and New Year's over there. And, of course, too, my daughter broke into their house. So, so Valentine's Day comes along, and, I'm getting ready to go, and I'm getting ready to go in the bathroom, and Briona comes out in her room, and she kind of just raises her hand. I thought she was saying good morning. But I realized later she was saying goodbye. Anyway, she went in the bathroom, and I ended up going to the bathroom downstairs. And I went to the bookkeeper's. I got back about 1:45 or so. And my wife said, she said that, she heard her walking around upstairs, because I asked if she got up. She said, I just heard her, upstairs a couple minutes ago, but she hasn't came down. So Briona had driver's training, I think at 2 or 2:30 or something. So we, my wife had made me a sandwich and stuff, and I ate. And I started calling up for her, and she didn't answer. So I went upstairs, and as I tried to get in her room, she was like behind it. And I broke through the door and kind of moved her aside. And I was screaming for my wife to call 911. And I tried to bring her back, but my needle was still in her arm. She's all blue, cold. My little girl was gone.
I've been around you for a while, and every time you tell that story, I don't know how you can do it. It rips. It's got to be like, just like pouring salt into an open wound or something. I don't know how you can do this. Because it's like every time, it's like you're reliving it every time you tell it.
I am, John. I don't retell it for me. I tell it, so I'm hoping that I can save somebody else's life.
But it's got to be hard on you, Sam. It really does, because it's always there, and it's always there when you're talking pretty much about anything else. It's always there's a sadness about you on this. It's when this subject comes up, it's just, I don't know. I think that it takes a special type of person to be able to go through this all the time. You can't be enjoying this. I don't know who would. And you persist in trying to get the word out. You're trying to get people aware. It's it's admirable. I just don't know how you can do it though. I really don't. I don't think I could put myself through this. And yet you're doing this on a larger scale than I would ever dare to undertake. I think it's rather heroic, and it's definitely you're going to be paying a price for it though. Emotionally, you have to be paying a price. Like in your day-to-day life, it's probably hard for you to actually concentrate on what you have to do for each day.
I struggle with depression big time, but the whole thing is, after Briona's death, I started to speak out. And as I started to speak out, everybody was coming out and saying that this is happening in their home. And I realized that there's an epidemic going on. And I didn't understand it. I didn't know what addiction was. Only because I felt like I went through everything, and it didn't affect me like that. But, as after Brianna, I kind of educated myself about addiction. And 10% of all of us have this addiction gene or this brain disease. And it doesn't manifest, sometimes it manifests early and sometimes it manifests later in life. But, I realized that there's an epidemic. And what happened is, I think the community kind of woke up because, 2 days later, we had another girl that died. Brianna was 17 and this girl was 19. And, they were friends. They were drug buddies. So the community rose, and, that's how community parent came about. And I don't know, about I think a month into it, I started speaking out, and they had me in the newspaper, and I don't know if I got on TV or whatever, but I realized, because I was getting cards and letters and phone messages and stuff from all over in Michigan, telling me that this is happening in their home, that they lost a brother, they lost a sister, they lost a mother, they lost a father to addiction. And about a month into it, I get a call from a good friend of mine. He says, Sam, they're making this program, and would you be willing to speak? And it was like, yeah, I'd speak, sure, because originally when we talked about it, it was like, these children, their brains are not, they're not all there yet, they're still immature to make these decisions for themselves, to get help and stuff like that. But when you're an adult, you're not going to listen to, whatever. So, we decided that we were going to hit the message to these kids. And when I was asked to speak, I said, sure, Then they came back and they said, man, it'd be powerful if you let us use your 911 call, And my wife was like, hell no, we ain't going to relive this every day, that we do this. But I thought, the message would be a lot louder and a lot more powerful if we did. And sure enough, the first time we did it at Briona's school, at her high school. And, I had my family and stuff around me. And that's another thing too. When my daughter passed, my mom and dad, they were overseas. And, but the rest of the family, I just felt like it brought us together, because I was trying to figure this out in my head, God, you gave her to me, I wasn't trying to have this child, but you gave her to me. Why did you take her from me? And I had a problem with it. I was mad at God, and I just didn't understand. But sometimes I guess we're not supposed to understand. We're just supposed to go through it, Well, that day, the first time we spoke, it was like, wow, because that's how powerful that presentation was. It was like, wow. Not only did I speak, but we had another parent, that the one that lost his child 2 days later, he also spoke. Then we had a deputy that lost her sister, she spoke. We had somebody that was a professional athlete that fell into drugs. He also spoke, and the sheriff, of course, he opened it up, and it was a very, very powerful program. And reliving the day she died and hearing that 911, it was very hard. But the way I looked at it is, if I could save one person from hearing Briona's story, then I've done something. That's how it all started. You see, I as we did it, I was in a depression, and I started reaching out for help. A couple months into it, my wife, bless her heart, she's like, "Honey, you need to get help." I'm trying to deal with the grieving, but my whole body ached. It's hard to get out of bed. Didn't eat, didn't sleep, didn't shower, shave. You knew, what you needed to do, but it was just like nothing worked. So my wife, she says, "Honey, please go get help." So I did, and I had this sweet, sweet lady that was my therapist. And, I'm a veteran, so I went up to the VA, and she cried with me, and she was very, it was good to have her to talk to. Well, a couple months into it, she says, maybe you need to get some sleep, and maybe you need to see the psychiatrist and let him write you a dose or something for you to sleep. And I'm like, I really don't want to take any medication. She said, well, there's like mild doses, they're non-addictive or something. Well, I decided to do whatever, I wanted this pain to go away. So, I seen the psychiatrist, and, within 4 months, I'm on 5 different medications. Didn't want to take one, but now I'm on 5 different medications. So the last time it was like, after we did that first presentation, I think we did a couple more while I was going through treatment and stuff. And, it was, I think we did maybe 4 or 5 that year. I think we went in front of like 7,000 kids or something. So, after the 4 months, I went back to the psychiatrist, and he's asking me, he says, well, are you sleeping? And I said, no. Are you still groggy in the morning? Yes. You still depressed? Yes. Well, maybe we need to change this medication. And I said, you know what, Doc? I don't think there's anything you can give me that's going to make me change what I'm feeling. I lost my child, Maybe I'm just supposed to feel that, He said, well, I don't know why you came to see me then. Something like that, I got up kind of halfway, and I had all this medication on his table, on his desk. And I said, you know what, Doc, I don't know why I came, but I know I'm not coming back. And I turned around and I walked away and never went back to see this guy. Sometimes these professionals, or you think they're professionals, this is all they know. They just know how to write, a prescription, and that's their way of treatment. That's what they're taught, okay? But if you look at it, how they're taught is by big business, by drug companies that just want to push pills and sell you that stuff. Well, I had I had a lot of anger when I started out, and I'm not angry anymore. And what's really nice is I went into a restaurant a couple weeks ago, and I had this girl. She says, I just want you to know, man, you changed my life out of the blue. I said, excuse me? She says, well, I seen your presentation at this high school, and I just want you to know you changed my life. It's like, wow, thank you. Well, in 4 years, I've been in front of over 50,000 kids. And, you say it's hard on me. Hell yeah, it's hard on me. But when you hear somebody tell you that, you know why you do it. And I think in life, I don't care, what you got or what you plan for yourself. Sometimes God just has a different place that he needs you to do or wants you to do. And that's just what I felt, and everything got thrown together, and I got put into a position to speak in front of these kids. And from that, it's like speakers have come and gone, but I'm still here. I'm not going anywhere. And the message is just beginning. This epidemic is bigger than we all are. And this fight, it's only the beginning. You see, if you look around, you got these coalitions going up in every community because drugs are on every block and in almost every home. There's too much wrong with our system. It's broken. And the only way it gets fixed is by communication and speaking up. And I'm the warrior for this cause amongst many. Okay. When I first was asked to speak, I just thought it was going to be, that one time. And I didn't know that it was going to be, just keep going. But last year I did this Dr. Nande show. And I don't know if they just televised it over in Kenya or whatever. But they were tweeting, and it was really nice to see that you touch so many lives, by telling Briona's story. And again, I started this, the whole thing was about saving one life. It's about how many we can save. And in this world of addiction, people die all the time. I told you 2 weeks ago, in 1990, I was in a bad car accident, and I was given Vicodins and Soma and Motrin and everything else for the back pain. And I had this friend of mine, he would just take all my script, for money, of course. At the time, I just felt like he's getting them from somewhere else. He might as well get them from me. And, but what happened is, at one time, we went out to dinner. It was me and Tina and him and his wife. And we were eating, and she nodded out in her plate I got to see firsthand what I was doing. And at that time, I told him, I said, listen, dude, I don't care where you get your shit from. I don't want no part of this. You ain't getting it from me anymore. He told me, I don't know why she's got to take so many. Damn, Well, this girl, she passed about a week ago from an overdose. That's the world of drugs. You can't run from it. But, we started out as community parent. And I thank community parent for the start of it all. I thank the founders, Joe Graves and Tony Brown, Bob Krug. Love you guys. You gave me an opportunity, and this opportunity isn't going to stop. We are Briona's legacy now, because this is what Briona really wanted. She hated drugs. She hated what it did to her mom. And I know she just thought she was more powerful than it. And she wasn't. And that's why we continue. The presentation now is going to be slaying the dragon. We're not chasing that sucker anymore. We want to rip its head off. We want to stop it. And I come to you today because I need your help. I need your help to keep Briona's legacy alive. And I need your help to stop these addicts, to help them. Because you see, our system is just broken. It's really broken. These people, they need help, not imprisonment. They need treatment, not to be looked upon in the wrong way. I used to think it was choice. You see, choice is that first time. It was my choice to light up or to smoke or to have that first drink. And it was their choice that first time too. But what happens is it grabs you. It grabs you, then you got no choice in the matter. You see, you ask anybody, if they choose to be an addict. They don't. Nobody wants to be an addict because it's a life of hell. You become the worst piece of shit on earth. You do anything and everything for drugs. This friend of mine that just passed, they found 5-6 different prescriptions from this doctor that had given her. 6 different prescriptions. Well, here's what happens, okay? I'm sure you've heard of Michael Jackson, Whitney Houston, the lead singer of Nirvana, or Robin Williams, that Hoffman guy. There's a lot of powerful people that's got all the money in the world, okay? And this takes you down. This will kill you, okay? Here's the thing, okay? Realize you have a problem. Get some help. And what happens is when we reach out for help, you're looked on as the biggest piece of shit because you become a piece of shit, okay? You become a liar, a thief. The lack of trust is gone, okay? You put yourself in that position, okay? You become that. So you have to understand, okay, when people look at you in that way too, okay? But, we've had this war on drugs since the 70s, and we keep building more and more prisoners, putting more and more police force, okay? I used to think the same way. Lock them up, all right? You look at our prisons, okay? 60% are mental health issues and drugs over that, okay? So it's not getting any better. And I think if we look upon it in a different way, it probably would cost us a lot less to give these people treatment. Okay? We tell them, yeah, this is a sickness, but in return, we treat them like a criminal. I don't know what's right or wrong. Okay? All I know is I'm a father that lost a child to this disease that you so-called is a disease. Okay? Let's look at something different. Come up to a better solution than just locking them away. When I think drugs and mental health, they're intertwined. And, depression, bipolar, with Briona, they kept telling me, oh, she's bipolar. That's why she's, she's self-medicating now. Well, she's sick, so she's trying to self-medicate. She's trying to be whole. Okay? We talked about 10%. Okay? A lot of times you go to a doctor, or let's say a dentist, you pull a tooth and you're in pain. You're going to be in pain for 3 days, 4, maybe 7 days, okay? They give you a prescription for a whole month. Well, 90% of us can take those pain for the pain pills for 3 days or 4 days that we're uncomfortable, and probably just put the rest of it, in our medicine cabinet. But those 10%, okay, all of a sudden they find their addiction, okay? It hooks them, 10%. When you talk to these government officials or whatever, well, only 10% are affected. Does that make it okay? 10% are affected? No, we're all affected by this. We are all affected. I said earlier that this is on every block and every community, which a lot of times you don't hear about it because people are embarrassed. They don't want you to know what's going on in their home. But if you look in your newspaper, okay, what's happening is 328 people die every day of addiction. 328 people. We lost one person to Ebola in the United States, and the president, he made the czar, and they made all these hospitals and all these things that are empty, that nobody's doing anything with it. But 328 people, and our government and our system got their heads in the sand, and it's only 10%. This is where I need your help. Because the louder we are, the more to be heard. Every time I go into a school, I'm so surprised by how many kids come up to me and tell me that this is happening in their home, or they had a problem and they've gotten clean, or some of the shit is crazy that you hear. And I'm glad that they feel comfortable enough to come up and tell me that. That's why this epidemic can only disappear, okay, by help from all of you listeners, okay? You got to join in this fight. Today I was listening on the news, and in New York City, they had the biggest bust ever. $50 million of heroin that came through the drug cartel from Mexico. The biggest bust. $50 million worth of heroin that they captured in the streets of New York. You know, the drug enforcement or whatever. That's just what you hear that didn't get away, that didn't come out on the street. How much are we missing out on that's getting by? You got to look at it that way. $50 million worth of heroin. Isn't that crazy? That's nuts. That is nuts. Well, why is it getting so bad with heroin? Because our doctors are giving it out like candy. Okay? They're giving it out like candy. You walk into your doctor's office and he's got 10 faces. You know, where's your pain level? Where's your pain level? That's the first thing they ask you. That's all they care to treat you about. That's where all the money is. 80%, that's 1 out of 5, okay, or 4 out of 5, die of addiction that started with the pills, okay, that turned to heroin. 4 out of 5 turn to heroin from prescription drugs. That's just crazy. You know, you look at all your athletes and people that go into the pro and stuff, and you look at all the ones that didn't make it, that had the talent, but they turned to addiction, okay? Or because they got hurt and they got turned on to a pain pill or decided to smoke a joint, and that was their life sentence. You look at all the NHL and the NFL, they're suing their owners because of all the drugs. They got them addicted. Every time they get hurt, give them a pill. Get back out there. Now they're suing all their owners. Why? Because they turn them into addicts. Because they don't give a shit about you or me or anybody else. They care about the money. That's what it's all about. Okay? And I'm asking you, whoever's listening, tell your friends. Tell everybody, okay? It's not 10% that's affected. We're all affected by addiction. And we can all put our heads in the sand and say it's not happening, but it's happening. And every corner of anywhere you go, it doesn't matter how much your house costs or what kind of car you drive, everybody's affected. And if it's not at your doorstep, it's coming. I guarantee you. I guarantee you. Please, okay? I look at it this way. One hand doesn't clap by itself. And the louder the voice, the more we're going to be heard. And the more that we're heard, the more that we can get something really done. 328 people die every day. And it's not these losers. These are very smart individuals that are sick. You know, we're not embarrassed to say, I have cancer or I'm a diabetic, but we're very afraid to say we're addicted. We have a brain disease because of this epidemic and how we're looked upon. This is happening to great people all over the country. Some of the smartest people. They're not losers. They're just sick. please pick up this fight. And you'll be seeing me and slaying the dragon coming to your school real soon. Because you, the children, are our futures. You are our tomorrows. And I'm not giving up on any of you. I lost my child, and I'm hoping that I save one of yours. Whether you pick up this fight with me or you don't. But I'm counting on you to help me. Again, thank you so much for listening today. This does take a lot out of me, but I think it's a great cause, and I believe that you're worth it. And if somebody just, you need help, reach out. There's hope out there, okay? And there's good people in every aspect, whether they're doctors or whatever they do, okay? That they're not thinking about the money. Find the right one that helps you, okay? Again, one hand doesn't clap by itself. I really appreciate you listening today. I'm Sam Jahari for Briona's Legacy. I'm hoping that you stay listening. All right, God bless. I'll talk to you soon.